I'm here in Madagascar following an aid mission to operate on as many children with facial deformities as possible. With only 5 days left, the team of volunteers must try to change the lives of over 400 children. But with resources and time running out, the team faces a huge challenge.
I think everyone's pretty excited about a week to come. It's a very full schedule. It's the most I've ever done on a mission, so we're going to get through them all.
Well, my normal day-to-day job is doing pediatric plastic surgery, so there are a lot of similarities because I'm working with children most of the time. But it's just in terms of volume and intensity and focus, it's much different.
Fridays and Saturday nights in accident and emergency is quite different from this. And just the people here are so kind and so generous, so grateful. And the whole team working together, there's a wonderful spirit amongst everybody, very kind people.
The volunteers bring a wealth of medical expertise to this mission, and later I found another individual who had dedicated the last 3 years to helping a group of villagers.
Jenny, these people have come a very, very long way, haven't they? Can you tell us a bit about their story and where they're from?
Sure. This lady here and her baby, they are from a town close to where we live. They came about 375 kilometers here to Ansir Bay to get the surgery. So she's about 1 year and 6 months old.
A year and 6 months. So this baby is the kind of prime age to be operated on, isn't she? In terms of it'll really make a huge difference to her life.
I think just because they do come from the countryside, there's probably a bit of fear right now.
Yeah.
This lady has never ridden in a car before. She's never seen a town. She's never been to a hospital like this before. So everything is very new.
Yeah.
I think it's comforting for them to have, some family and some people that are from towns close to them also, and just see the other children and people here.
Okay.
In the screening room now is a little boy named Jean-Paul. He has a cleft lip, but he's the prime age for a successful operation. But his overall health must be given the all clear before he can receive surgery. The doctors detect a wheezing sound in Jean-Paul's chest. If this is serious, he may not be allowed surgery.
His lungs kind of sound very noisy, his breath sounds. So we want to differentiate something that's deep down, like a pneumonia, versus something that's just due to upper respiratory secretions. I have noisy breath sounds. Of course.
Even though the doctors only have his best interests at heart, it will be hard for his father to understand.
Oh, he has a complete cleft of the lip and the whole roof of his mouth, the whole palate, right to the very back part. So he's the full meal deal, as we say. Yeah.
I talked to an anesthesiologist about his health check.
3-year-old little guy, he's a bit small for age.
Yeah.
He weighs 10 kilos, which is about the weight of in England it will be about a 1-year-old. Okay.
With Jean-Paul's weight being so low, he may not stand up to the rigour of surgery. There are hundreds of boys and girls like Jean-Paul, and they will now have to wait for tomorrow to hear if they are one of the lucky ones. This is a really heartbreaking story. This lady has just been told that her baby is not able to have the palate operation. She had the lip operation last year because she's still so malnourished. I don't know if you can see how big this child is, but she's nearly 2 years old. And she looks to me to be like a Western 5-6-month-old baby. It's absolutely tiny. Tiny, tiny, tiny little hands.
we've just seen that very distressing situation where the little girl, who was actually 22 months old and had had the lip operation last year, needs the palate operation but is not yet strong enough to have it. And Anta's going to tell me a little bit more about why that's the case.
It's very sad. Father was crying, everyone's very unhappy. It happens. Unfortunately, the baby who we thought in the screening process was about 3 months old actually turns out it's 22 months old, so almost 2-year-old child. Very malnourished, very small, very weak, and basically she wouldn't be able to stand the anaesthetic, so unfortunately she's been rejected on this occasion.
But it's a bit of a vicious circle, isn't it? Because at the moment her mother's having a lot of trouble feeding her, so until she can feed her more easily, then she obviously won't be able to be strong enough to have the operation. So what can Operation Smile do in this situation to actually either educate the mother about feeding her better, or is there anything else that they can do to help?
That's exactly, yeah. We don't say goodbye and turn people away. They can go and see our dentist here, our speech therapist, all other disciplines that can educate mum and dad as to how to feed the baby, give them tools to help them feed the baby, often a plate that fits into the mouth that enables the food to go the right way down instead of coming back out again. And things like that will make a huge difference to this child who is clearly undernourished.
Many more children are turned away due to lack of funds, so they're dependent on this charity to create partnerships back in the UK.
It's been great that we've been able to get involved to help raise awareness of the work that you're doing here, and I think sort of coming here myself, so my first impressions of it are, I think that the people are extremely grateful that you're here helping them. And it's amazing, I think, to see the difference that it's going to make, I think. And over the next few days, when they have the operations and we kind of see the results of those, it's going to be pretty amazing, I think.
It'll be fantastic, but I think this is a really good example of why we can continue to fundraise and need to raise more awareness of the sort of work that we're doing, and why we get people like you involved, because of the sort of 400 patients that we've screened so far, we're actually only going to be able to operate on 150. So that's quite a lot of patients we've still got to turn away. They will all be treated, which is great, but that's why we need to keep coming back to these places and making sure that everyone is seen and everyone is looked after.
And is that like a time or money thing, that the reason why you can't
it basically goes down to money, because
okay.
If we don't have the funds, we can't get the people here, we can't get the equipment here, and we can't support the projects. So ultimately it's funds. The volunteers are great. They've been with us for 25 years, most of them. So
the more awareness that you can raise, the more cash, and then the more operations you can do.
Absolutely, yeah.
Okay.